Assalamualaikum warahmatullahi wabarakatuh to Madam Nordiana binti Nordin. So this is our group assignment presentation which titled Compliance Challenge and Solution Strategy in Health Information Governance. Next, I will introduce our group members. First is SAFIAH binti NORJAFNI, second is ATHIRAH binti ABDUL, and third is me, which is Safura binti Ruslee.
Starting with an introduction, information governance refers to how organizations manage and use information effectively to improve efficiency and compliance. In healthcare, health information includes medical reports, patient data, diagnosis, and health service information. However, applying information governance in healthcare is challenging due to complex regulations and inconsistent policy implementations. These issues create compliance gaps and ongoing problems. Therefore, through this paper is to discuss the major compliance challenges in health information governance and propose suitable strategies to address them. Next slide is the research objective and research question. The research objectives of this paper is first to examine the nature and impact of compliance issues on healthcare organizations, particularly in relation to health information governance practice. Second is to analyze the role of information technology in facilitating compliance with health information governance requirements within healthcare organizations. And third, to propose best practice and strategic measures for strengthening compliance in health information governance in healthcare sector. Apart from research objectives, the research question of this paper: first, what compliance issues affect healthcare organizations in the context of health information governance, and how do these issues impact organizational practice? Next is, how can information technology facilitate compliance with health information governance requirements in healthcare organizations? And lastly, the third research questions are: what best practice can be adopted to improve and sustain compliance with health information governance in healthcare organizations?
Next, document analysis. This structure is used as the main source for the method in this research paper. These methods include books, documents, academic journal, and institutional reports. A method that uses various types of documents based off scientific papers is qualitative analysis. With qualitative data, one can maintain chronological flow to obtain a plausible explanation for the results. For this research paper, we use analysis based on journal articles. Next, significance of the study. It helps in contributing to providing exposure to healthcare institutions regarding the disclosure of compliance challenges that often occur when health information governance management is applied in health organizations. In addition, this research paper also conducts several analyses on solution strategies that can be used to overcome the challenges faced so that the HIG implementation process can be carried out perfectly. Next, literature review. What is IG? Information governance is a strategic framework comprising the norms of procedures, rules, and standards that individuals and organizations use to create, arrange, secure, preserve, use, and discard information based on organizational goals. Next, Health IG. Health IG in healthcare organizations is a critical framework that establishes centralized policies, procedures, and accountabilities for managing patient information effectively. Next is what it is important. HIG is crucial as a tactic to guarantee that information is a valuable resource that must be utilized to support corporate decision making, then to provide healthcare facilities that are prepared to use information system at all levels. Next, National Health Services. The NHS is a universal healthcare system sponsored by the government. In the United Kingdom, the NHS was established in 1946 and it's responsible for the public healthcare sector. Furthermore, it provides preventive medical services, primary care, and hospitals to all ordinary residents in the 4 regions.
Next, I will present about the compliance challenge in health information governance. First is financial sustainability. According to the analysis Mark Hallowell et al. 2035, the role of private healthcare providers (PHP) has outlined that the governance must intervene through regulation to protect patient safety, quality of care, and consumer rights for privately funded patients, such as those who do not rely on out-of-pocket payment or any private insurance. The protection of medical record is the second obstacle to compliance with HIG. This allows maintaining record security and producing record with integrity, confidentiality, and availability of health record. We provide issue in ensuring that every business compliance with the established compliance and standard. Next, for the third challenge, ethical implication of AI in healthcare. This allows healthcare providers such as healthcare organizations use AI service in their healthcare system. However, despite the facility provided, it is a big challenge to regulate its use by healthcare organizations. In particular, each of these regulations must comply with the standard outlined under the Data Protection Act 2018 and be consistent with such compliance.
Additionally, another major challenges are the issues of inadequate resource within healthcare institutions. Based on the input from the research shows that most organizations face problems in having to keep working even with limited employees, which is the number 24.4%. The lack of employee can cause further problems in ensuring the operations in the information department are controlled and difficult to monitor and keep track of the compliance update of the organizations. Not only that, the lack of equipment such as computer also resulting in the lack of efficient systems to assist in managing sensitive data, leaving the data vulnerable to danger. Without a strong internet connection, also could slow down the system operation and hinder the healthcare productivity. And the less common challenges that prevents organizations from properly complying with established standards are inadequate competency. Based on the research, this issue occurred because there are employees who do not have the knowledge of the work they need to handle, especially in the handling of the data, especially in the handling of health data. This can lead to staff negligence, in which the staff fail to conduct their duties properly by not following the established procedures. This may cause harm to health data. Furthermore, the staff that are not trained properly may lead to a staff doing their job without following the proper policies and regulatory.
Next, I will explain about the solution strategy in HIG. First is better budget planning. It could improve central-local collaboration and diversified finance. This has made it possible for several grassroots organizations to implement cross-departmental assessment standards that are connected to funding and have incorporated into the larger evaluation to establish financial sustainability. For example, in China health sector. Second is implementation of blockchain technology and hyperledger fabric technique. According to study Rita Azizi 2035, blockchain technology is a technology that enables decentralized management, ensure the integrity of information that increase the degree of the accountability to the system, and provide an untouchable audit trail. Therefore, a proposal is the creation of Hyperledger Fabric, which involves three critical components, which is data acquisition, data isolation, and data access control to ensure the management, protection, and correct use of patient data. Okay, next is encourage to address issues such as informed consent, algorithmic transparency, and cybersecurity risks. In addition, Rogierets et al. Argue that a framework for fully trustworthy AI is when it's presented by effectively linking ethical principles with regulatory and technical requirements.
As for the issue related to the staff problem, it can be solved with continuous educational program by conducting a seminar or talk program that focuses on standard regulatory by explaining and introducing the principles, legal requirements, and procedures of health information governance (HIG) to all staff will provide them with a deeper exposure to the subject, ensuring all employees clearly understand compliance standards, data protection responsibilities, and policy implementation in their daily work, resulting in a more disciplined workforce, more controlled health data storage, and support the development of a compliance-driven culture within the healthcare organizations. After that, the last solution is to provide compliance training by organizing an ongoing training program that focuses on reinforcing employees' knowledge on regulatory requirements, data security practices, and ethical handling of health information. This can help to enhance their knowledge, but at the same time, strengthen their skills. Consistent training promotes compliance awareness, minimize data handling errors, and strengthens adherence to information governance policies and strengthen overall compliance performance.
Okay, next, I will present for the recommendation for future researchers through our paperwork. First is using quantitative technique. Use questionnaire study or interview technique, for example, to collect information related to the challenge of compliance. Next is ensure quality of the data. Future researchers needs to make sure every fact and analysis issue accurate and able to be linked to what is targeted according to the objective of the paper. Next is security privacy regulation. Future researchers need to make sure the data comply with the Hack Portability and Accountability Act of 1996, HIPAA, and General Data Protection Regulation (GDPR) standard provided. Next is training on data quality assurance to guarantee that the data security is always upheld. Special record are only shared with pertinent party. And next is capable to adapt data governance. This allow roles and procedure of data collections, storage, access, and sharing need to be outlined.
For conclusion, this research paper revisits and reinforces the core thesis statement that guide our discussion, including the key subtopics such as the compliance challenges in health information governance. These findings reflect the depth of the issues discussed and provide a clearer understanding and the complexity surrounding compliance within the health information environment. Furthermore, the implication of this finding extend beyond the immediate context, offering insight into how current compliance challenge may shape future developments, policies, and knowledge in the broader field of health information governance.